Hi everyone, I'm Sonia. I'm a registered nurse and a doctorate student in Yakima, Washington, and I'm here today to talk to you about how a simple school-based health policy could reduce the critical threat of childhood obesity in our nation. My message today is targeted towards 3 elected officials who are in a prime position to advocate for obesity prevention policies in the school environment. The officials that I hope will hear this message today are Selah School District Superintendent Shane Backlund, Washington State Superintendent Randy Dorn, and the United States Surgeon General Vivek Murthy. Childhood obesity is truly one of the greatest threats to the future health and well-being of the United States population. Over the past 3 decades, the incidence of childhood obesity has tripled, and one-third of our nation's children are now overweight or obese. The health risks associated with childhood obesity are severe and can lead to increased rates of chronic diseases and shorter life expectancies. Perhaps even more significant are the long-term consequences suffered by our nation as a result of the obesity epidemic. Did you know that obesity adds more than $150 billion to our national healthcare costs each year? Or that right now, 12% of men and 35% of women of military age are ineligible for service simply because they're overweight or obese? Most of us don't consider the impact of childhood obesity in terms of national security and federal spending. And many people view obesity as a personal responsibility that the government shouldn't be involved in at all. But the truth is, obesity has a detrimental effect on the health and safety of our entire nation. Research has suggested that the most effective way to reduce the burden of obesity in society is to prevent its development in childhood. A few months ago, I spoke to you about the importance of improving school nutrition standards, and today I'm here to advocate for legislation that would mandate annual school-based BMI screenings for all students. A child's BMI is a measure of their weight in kilograms divided by their height in meters. The U.S. Preventative Services Task Force recommends that all children receive annual BMI screens to aid in the prevention and early diagnosis of obesity. Although most pediatricians do measure height and weight on an annual basis, more than 50% fail to calculate BMI. This often leads providers to overlook weight gain in children and miss a critical opportunity to educate children and parents regarding healthy weight, weight loss, and diet and exercise habits. Public schools are an ideal venue for obesity prevention policies because children spend a majority of their waking hours in school for 9 months out of the year. As part of the Healthy Hunger-Free Kids Act of 2010, school districts were required to create a wellness policy that outlined how the school district is fighting obesity. I propose that part of this legislation includes a mandate requiring school districts to conduct annual school-based BMI screenings for every student. Similar to vision and hearing screens, students would have their BMI calculated and measured by school nurses, who would then forward results to parents for education and follow-up purposes. Successful BMI screening policies could dramatically improve the health of our nation's children and decrease our national health care costs. It is estimated that if BMI screening policies were effective in helping 1 million children maintain a normal weight throughout their adult lives, federal savings would range from $113 million to $44 billion. School-based BMI screenings are a simple yet cost-effective way to reduce the burden of childhood obesity in our nation. I urge you to support this legislation in order to improve the health and safety of our community, our state, and our nation as a whole. Thank you.